Gilfi, good morning.
Good morning.
Welcome to the conference. Welcome to everybody, to the speaker of the conference. I give my welcome to Gilfenson, and I'm sure that the session will be fruitful and interesting, and thanks for being here. I regret that Professor Brunetta, Minister Brunetta, has been not able to participate to the conference, but we are starting now on the topic that is on the basis of the session. Please go ahead. Thanks again to all participants.
Thank you, Luigi. It's wonderful to have the founder with us from the very beginning. So we have a wonderful session here on COVID-19, some evidence and pandemics and vaccines. We have 3 papers from Reykjavik and from Bari and from Paris, and they are in the schedule in this order. I suggest that each speaker takes up to 25 minutes for the presentation, and that will leave a total of 15 minutes for questions and answers directed to all 3 speakers at the end. So without further ado, we start with the paper from Reykjavik by Zoega and Gestsson, and the title is COVID-19 and the Golden Rule of Social Distancing. Gylfi and Marians, please go ahead.
Hello. I guess now we should see the transparencies, the slides, no?
Not yet.
Yes.
Yes.
Okay, very good. Okay, Thorvaldur, does it work? You see the slide?
Works for me.
Okay, great. So this paper starts with the premise that COVID is here to stay, that there will be new variants threatening our health for some time to come. Like these days, we have the Delta variant, and the question is, does it evade the vaccines? And so the idea is this, that for some time to come, we'll have to take this pandemic into account. That it's not just a matter of time until it disappears, but that it is here to stay. And the idea then is that societies will have to engage in some sort of social distancing to reduce the rate of infections and to reduce the mortality. And then that leads us to an interesting trade-off, which is the trade-off between economic activity on the one hand and lowering the rate of infections on the other hand. And the way we model this is that by reducing the infection rate, we reduce the mortality of the old, and hence we increase our own life expectancy if this is something that is here to stay. So the trade-off is the following. Should societies reduce output and consumption in order to extend our lives? Do we want longer lives with less consumption per year, or shorter lives and enjoying every year with more consumption? And this leads us to a trade-off which resembles what we found in Ramsay's golden rule, and Ned Phelps's, who was here yesterday, golden rules of economic growth. So in these papers, there's a trade-off between current consumption and future consumption in Ramsay. And in the Phelps papers is about sacrificing consumption to increase education or research and development and so forth. So in our context, the golden rule involves how much consumption a society should sacrifice in order to protect the old, and by extension, to lengthen our lives. So how much should we sacrifice to have longer lives? And so the first slide here, so it says new variations of the virus prevent herd immunity from arising. There will be, in steady state, always some people get infected, and then some people who may die. And this leads us to this economic trade-off between social distancing and economic activity, between longevity and consumption. We see this all around the world, this trade-off. I mean, like this conference, it would be more enjoyable if we all could meet, go to dinner tonight and so forth. That's the activity. But we're doing this online for health reasons. In the UK, on July the 19th, they want to remove all restrictions. It's done because of the economy. And then people say, well, this will have bad consequences for infections and deaths. So all countries are involved in this kind of a trade-off. And this is what we modeled with a mathematical model, which I'm not going to show here. It's just going over the intuition. So there are a few papers that touch on things that are in our model. There's a paper by Glover et al. About intergenerational trade-offs when the old are more at risk in this pandemic. There's a Hausman and Schetter paper which says that poor countries cannot really afford the social distancing, because then if you start at a very low level of output, it can lead to economic deprivation. There's the Acemoglu paper about mortality rates differing between age groups, leading to like locking up the old people and limiting their interaction with the younger generations. So you can have social distancing which differs between groups. So this is all related to what we're doing, but what we do differently is we assume, it's sort of a pessimistic assumption that COVID, like the annual influenza, is here to stay, and it can be more difficult to deal with, more dangerous than the flu. Okay, so we go over this. There are two generations. It's the young and it's the old. And by old, we mean the retired. So this is a bit ad hoc, but it's a modeling assumption. There are new waves of this pandemic that enter the country continuously. There's a continuous inflow from other countries of infected people, bringing these new variants, and they affect both the young and the old. This then gets transmitted throughout society, and the rate of transmission depends on social distancing and also on the share of the population that has been vaccinated. By assumption, the young recover. Now, this is a strong assumption. We could relax it and have more generations. So the very young recover, but for simplicity, for the mathematics, we say the young recover with probability 1. The old, most of them may recover, but not all of them. And how many of them recover depends on the quality of the medication and treatments available. Okay, so this is the world that if we're in Italy now, there are people entering Italy who are infected. They infect Italians, Italians infect each other. The young recover, but the old, some of them die, others recover. And so Italy may then decide on social distancing. Through social distancing, productivity is decreased. Think of tourism or the service sector. So the service sector is especially vulnerable to social distancing. And there's a benevolent social planner like Mario Draghi, who decides on the level of social distancing in Italy. He has to have a balanced current account, so we're not going to borrow abroad to finance anything. And he wants to maximize the well-being of each Italian over his lifetime. So he said, some of us are young, some of us are old, but this is here to come. Let's find the optimal social distancing so the average Italian is as well off as possible over his finite lifetime. And we get the golden rule. I fear Ned is not with us, but this was for him. The motivation for this I got from having dinner with Ned in New York some years ago, and he said, well, the young should just enjoy their lives and not spend many resources on the old. And I was sitting next to Mr. Golden Rule, so I thought, why not formalize this? And then Maria's help with the math to do this. So there's a golden rule. We should increase social distancing until the marginal benefit is equal to the marginal cost from increasing social distancing. And the marginal benefit of increasing social distancing is that we get increased longevity, longer lives, because fewer people get infected and fewer people die. But the marginal cost of social distancing is that we'll have less consumption per year, and both because there's less output, especially in the service sector, but also because there are more old people to support. So there's a sacrifice of consumption for the working age and everyone else. That is the cost. So as we increase social distancing, we extend our lives, but each year of our life has lower levels of consumption. So we're poorer, but we live longer. And then we show that this golden rule depends on the output per capita. Rich countries, which start with a high level of consumption, have a lower marginal utility of consumption, so they can afford more social distancing. A country at subsistence levels cannot afford social distancing, so that the level of social distancing would differ between countries. The rich should do more. And the larger is the service industry, like tourism in Spain and Italy, the less social distancing you can do because the sacrifice in terms of output will be greater. So a wealthier country does more, a more service-oriented country does less. Now, if medication is invented that helps alleviate this disease, that should reduce the need for social distancing. Vaccination, if it's effective, should also reduce social distancing. If everyone is vaccinated and the vaccination works, there's less social distancing. And then finally, the more people enter the country with new variants, the more open are the borders, the more social distancing do you need to have. So you need more social distance. You would have more social distancing than in a rich country with a small service sector, where there's medication available, everyone is vaccinated, where the borders are closed. So that's the comparative statistics of this exercise. Now, I checked the data on cumulative infections and deaths by the 27th of June from the Johns Hopkins database. So I had, in fact, is the number of infections per capita, deaths, but is the number of cumulative deaths. And I regressed it on output per capita, the share of services and employment, and a dummy for islands, because islands find it easier to control their borders. And as it stands now, it's not the case that the rich countries have fewer infections and fewer deaths. So we have rich countries like the United States is doing really badly, and a relatively poor country like Greece is doing much better. So Greece both has an important tourism sector and low GDP per capita. So they should be doing less social distancing and have more infections, but they are actually doing better. The one thing that works is that the island dummy has a negative coefficient, which means that islands are doing much better. Islands have fewer infections. So Iceland is doing well, New Zealand, Australia, at least until recently. So islands have a lower inflow of new infections, not doing better. So now here in Reykjavik, we have no mandatory social distancing, but the borders are being controlled because it's an island. So we can get away with setting S to 0 because the borders, there's one airport where people are tested, but this may be going too far. There should be some social distancing here, but that's the way it goes. Okay, so I think this is the last slide. So now this, what we have derived, may point the way to some conflicts between industries within countries and between countries, so that the low-income, high-service countries would have less social distancing, more infections. Poor countries can't afford the social distancing, while the high-income, smaller service sector countries will have more social distancing and fewer infections. So a rich country should get this pandemic under control, but the poor countries will find it more difficult to do so. So now with people moving from one country to another, there will be problems at the border when people from the poor countries enter the rich countries. And the poor countries will also have low vaccination rates, in addition to low social distancing and high infections, bringing then new variants into the rich countries that have both high vaccination and can afford the low social distancing. So, so this will lead to the following problem, like we're facing today. A lot of people have been vaccinated in Italy, but we're still not going to Villa Mondragone. So it means there may be an incentive to have checks at the border to allow people within the country to have a normal life. So border checks may be here to stay. But then there arises a second problem within the country. You may have, like Italy with tourism and manufacturing. Tourism will demand open borders, whereas manufacturing may demand closed borders so that people can go to work and produce. So there's a conflict between the service sector, especially tourism, and the rest of the economy. And there's a conflict between countries. So the way out of this would, of course, be to vaccinate everyone, for the rich countries to help vaccinate the poor, so that this global problem can be brought under control eventually. So I think that's it. Yeah. Thank you. That was it.
Thank you, Gilven Marias. This was wonderfully clear.
And Marias will help take the questions. He's has the honor of doing the mathematics. And
yes, we'll defer the questions until the end of the third paper. So we now move from Reykjavik to Bari. We have a paper by Mare, Giale Leonardo, Motroni, and Porcelli, and the title is Family Ties and the Pandemic, Some Evidence. So yes, I ask the speaker to step forward. Yes.
Yes, welcome. Thank you very much. Good morning. Let me start thanking the organization of the conference, University of Tor Vergata, and in particular Professor Paganetto for inviting us. So let's move directly to the slides. I will share the screen. Just a second.
Yeah,
Let me, if you can see the screen.
Not yet. Yes.
Now, yes.
Yes.
Okay, so this is a joint work with Luca Di Gianleonardo and Antonello Motroni from the Ministry of Finance, and from with Professor Mauro Mare, that is also here in the room. So there are many papers now that are exploring or trying to explain the diffusion or the spreading of COVID-19. Probably the number of papers are spreading much faster than the virus in itself now. And we are trying to make some small contribution to this literature with an empirical analysis that is trying to show the correlation between the spreading of the virus and a particular aspect of social capital. Our exercise has been also published in the COVID economics collections of the CPR, and actually is showing that there is a correlation actually between family ties that I will show you in a minute as can be defined more in more details. But this is a particular aspect of social capital. So there is a correlation between the strength of family ties and the contagion rate, so the spread of the disease. Actually, this is our main point. As I said, the literature, the pandemic literature, we can call it in this way, is very vast now. Since March of last year, now the number of papers is huge. There are many papers that are trying to explain the contagion rate in terms of epidemiological and healthcare elements, clearly. And are trying to explain how the virus works, the main mechanism of the diffusions. There are also many papers that are trying to that are focused on other technical aspects, like, for example, the geographical characteristics like humidity, the role of pollution. Then some papers are focused on the intensity of traveling and so forth. A slightly smaller number of papers instead is focused on the role of the social capital. We all know that social capital is a sort of umbrella terms. If we take the definition provided by Putnam in 2000, social capital can be defined as a sort of a connection among individuals in terms of social networks and norm of reciprocity based on trust that essentially are shaping the social relations. And actually, the level of trust is the main pillar of social capital, but social capital is a multidimensional phenomena. And actually, there are also other papers that are trying to focus on the role of trust, trust in governments, trust in the rules of each country as a main component of the diffusion of the virus. And we are trying to provide some contribution along this line, focusing on the role of family ties. And actually, as I said at the beginning, we see that when family ties are strong, social capital is weak because you trust more your family and less your neighbor. And so this is decreasing the level of social capital. And in turns, this is providing, let's say, making faster the diffusion of the virus. We have also explored the role of social capital in another work. In connection with tax morale, for example, and tax evasion. So family ties and social capital are components that are very important for different aspects in economics and in political economy. So as I said, we are trying to explore this connection. I will go directly to the structure of the data set, constructing a cross-section of 63 countries. Spread all over the globe, and measuring 7 different dimensions. Of course, the first dimension that you see here is the spread of the virus in terms of COVID cases for 10,000 inhabitants, COVID death for 10,000 inhabitants, the COVID death ratio, the ratio of death over cases, and the recovery ratio. These are taken all from the repository of the Johns Hopkins University. Then there is the second dimension that is the family ties dimension. Family ties are measured using 3 different components that we can see here in more detail. So we'll show here more details. These are the measure of family ties. We are using 3 variables from the World Value Survey. The first variable is covering the importance of family. Is a general question that asks people to say how important is family in his life. Then there are 2 different channels of family ties. The first channel is from children towards parents, and is the love and respect of parents, what we call love parents. And then there is another channel that goes from parents to children, and we call it help child, and actually is the parents' attitude towards the well-being of the children. And then we are taking the principal component of these 3 variables. Here we can see the country that are covered in our analysis, and in darker blue you see the regions, the countries where family ties are stronger. This is our principal component analysis. You can see that if you focus on Europe, for example, you see that the northern part of Europe is the part of the continent with lower family ties. The Mediterranean part is characterized by stronger family ties, and this is the situation for other countries that are covered in our sample. And it's interesting to see how the channels of family ties, the channels that goes from children to parents, is not actually the same as the channel that goes from parents to children. On the top here, on the right, you see the help child variables. So the parents' attitude towards their children's well-being. That is slightly different from what you can see from the other channel of family ties. Then the third measure is the general importance of family. Actually, so these are the 2 main components of our data set. Then we are taking a huge set of control variables on other 4 different dimensions. We have the dimension of trust and religion that cover other aspects of social capital, like trust towards people, the rule of law, trust towards church, and religiosity. Then there is a policy component. We are using the COVID measure stringency index from our world in data. Then there are economic variables, GDP, Human Development Index, health expenditure as a percentage of GDP, number of beds for 1,000 inhabitants, and health expenditure as a percentage of GDP. Then geographical variables, latitude and the North Hemisphere dummy. And finally, some demographical variables, age, life expectancy, diabetes prevalence, and cardiovascular death rate. If you see the raw data, you clearly see some very, let's say, weak but evident correlation between family ties and the spread of the virus. Here you see the correlation, the raw correlation between COVID cases and our measures of family ties. It's interesting to see that if you take the principal component of the 3 measures, you have an evidence of a quadratic relationship between family ties, the intensity of family ties, and the number of cases per 10,000 inhabitants. And this quadratic shape seems to be determined by a different relationship between the health child variable that has a positive correlation between the spread of the diseases. So when parents care from the well-being of their children, the spread of the virus seems to be higher. Instead, when are the children that care for the well-being of their parents, the spread of the virus seems to be lower. And the combination of these two factors seems to produce this quadratic relationship. That can be seen also in connection to the death rate. Here you see the same raw correlation between family ties and death rate, same situation. And you can observe a reverse situation, a reverse evidence if you take the correlation with the recovery rate. If you take the recovery rate, you see a U-shaped relationship and an inverse correlation with the variable health child and a very mild positive correlation with long parents.
Non si vede la slide.
You don't see the slides?
Yes, now. Yes, okay.
Okay, please tell me if there are some problems with the slides. Thank you very much. Then this is the basic evidence. Then we took to the econometric model. This is the empirical strategy. So we have a simple cross-section here, an OLS relationship, LOS estimator, where we put as a dependent variable in terms the intensity of the COVID-19 outbreak in terms of contagion rate, in terms of death rate and the recovery rate. On the right-hand side of the model, we put our measures of family ties in a quadratic form, of course, as we have seen from the raw evidence. And then we have our measure of social capital in terms of trust and religion also. Then the policy index in terms of stringency index, economic variables, geographical characteristics, and then demographic characteristics. And these are the main results. In the complete analysis, in the complete regression, where we have all the variables together, we clearly see that the quadratic relationship that we observe between family ties and this is the number of cases per 10,000 inhabitants. Clearly, there is a quadratic relationship. But this quadratic relationship is going to disappear when we put all the control variables in the regressions, and still remains a strong positive correlation. That actually, since here all the variables are standardized between 0 and 1, you can compare also the magnitude of the effect. And you can observe in blue all the variables for which we expect, let's say, what we have as a prior. There is a relationship that is coherent with our prior. In red, something that is counterintuitive in terms of correlation. And family ties clearly appears as one of the stronger factors in terms of correlation between the number of cases. Then is followed by some characteristics in terms of social capital, like, for example, trust people is reducing the contagion rate. The rule of law index is reducing the contagion rate. The trust toward the church instead is increasing the contagion rate. Instead, the fact of if you are a religious person, the contagion rate is going to be lower. In terms of GDP, we see a positive correlation. It is counterintuitive, but is probably explaining the fact that richer countries are able to track better the number of cases, clearly. And then we also see a positive correlation with health spending, which probably is related to the same phenomena, the fact that richer countries are able to track better the diffusion of the virus. Instead, we see a negative correlation with the number of beds. The same evidence can be seen if you consider the COVID cases per capita, considering in a separate way the three components of family ties. And as we have seen from the raw data, the help child component is the one that is driving the results. Instead, we don't see any strong correlation between number of cases and the other two components of family ties. Actually, there is a slightly negative relationship with love parents, as we have seen. Similarly, we have actually not in contrast with this evidence, if we consider the death rate, we don't see any relationship between family ties and the death rate. What counts for the death rate are structural characteristics, like, for example, the number of beds, the geographical position of the country, and the life expectancy that are correlating as we expected with the death rate. We found a strange correlation with the Human Development Index, but is very weak. So family ties and social capital matters for the contagion rate, but doesn't play any role for the death rate. Then we have the regression for the death rate per capita, and finally for the recovery rate, but the conclusion are pretty much the same. So to conclude, our results seems to show that social capital component matters in trying to explain the diffusion of the virus, and among them, family ties, the strength of the family ties should be taken as one of the main components of the social capital that matters in this phenomenon. And they matters only for the contagion rate, not for the death rate, where instead it's important to take into account other structural characteristics, like, for example, the efficiency of the healthcare system. And clearly, there are some policy implications that can be taken from this analysis. We are still waiting for the vaccine to reach their full effect in protecting the population from the spread of disease, but still in waiting for the herd immunity. Social distancing is the main, let's say, weapon that we have against the virus, and we have to take into account also some social norms when we take into account the effect of social distancing provisions. It's important to, let's say, separate in a certain sense the younger from the elderly. And this is not easy where family ties are very strong. A final point in connection to the next steps. From the econometric point of view, we are exploring the possibility to estimate a panel structure of this model. Of course, it will be a daily panel, considering the contagion rate day by day. We have tried this alternative estimator, but we didn't see any strong difference compared to the cross-section analysis. And actually, we believe that the cross-section is more effective as an estimator compared to the daily panel, since most of the variables, of course, don't change on a daily basis. As a further extension, of course, we want to expand this analysis to the second and the third wave, since actually is confined to the first wave, to the period between March and September 2020. And finally, we want to take into account also the role that the vaccine is playing now in reducing the spread of the pandemic. So thank you very much. I hope that I've been in time for the presentation. Thank you very much.
Thank you, Professor Bocelli. This was a wonderful tour of your data set with lots of new and surprising results. Thank you. We move now from Bari to Paris, where Turner, Eggert, Julia Mette, and Botef will present a paper called the Tortoise and the Hare, the race between vaccine rollout and the new COVID variants. May the speaker step forward, please.
Yes, hi everyone. I just started sharing my screen. I hope you can see it.
We see.
Okay. So this is I'm Balázs Zsiget, and this is joint work with Dave Turner, Ivan Giemet, and Jakob Botev. We are all from the OECD Economics Department. So the hair in the title of our paper is reflecting the quick spread of the alpha and delta variants, how overnight they can take over other variants. So this is an example for the UK. The alpha variant is becoming the most dominant variant, and then the delta variant more recently overtaking the alpha variant. So this is just like the hair part. And then the tortoise part is the vaccination rate. Vaccinations have been painfully slow in many OECD countries. So this is for June this year, and you can see that the median is around 30%. This is vaccinated twice, because vaccination only once it's not very so powerful. So we only look at the vaccination twice. And then there are many countries even much lower vaccination rates. Of course, with some exceptions here with Israel, Chile, UK, and the US. So yeah, so there's some standard facts. So you can see the median reproduction number here. So then dropping dramatically early last year, and then fluctuating in a band of between 0.7 to 1.8 over time, with some cyclical seasonal factors and then some variants coming in. And then we have on the left panel, we have the OECD weekly tracker of GDP, which is kind of like a proxy for GDP. And then we can see the large initial drop, recovery, but still we are below the initial level as of May this year. So these are the questions we try to address. What are the impacts of policies on the daily reproduction number, and what are the economic costs, which measure with the weekly OECD GDP tracker. So we use daily data. We estimate two regressions, one for the reproduction number and the other one for the weekly GDP tracker. So we use a number of policies, the lockdown measures, a variety of them, then public health policies, including test, trace, and isolation, mask wearing, protection of the elderly, and we also have a variable capturing vaccine rollout. And then we add seasonal effects, which you capture by the number of hours, daylight hours. And then we also add variants of the virus to see whether this has an impact on the reproduction number. And we will see that they will have. So we basically use the Oxford University dataset of containment measures, which have a range, which everybody knows these measures. So they range from 0 to 2, 3, or 4, depending on what specific variable we are looking at. But because using such a range in regressions would imply that the change from 1 to 0 and from 3 to 4 should have the same linear effect. So so there's no reason that this should be linear. So we just decompose every variable into dummies. So for every level of stringency, we're gonna get a different dummy, which take the value of 0 or 1. Okay, so then just like some of the data, I'm probably, so the median values in red, and then the shades describe the proportion of countries in the different levels of stringency. So we have workplace closure, school closure, stay-at-home requirements, cancelling of public events, restrictions on gatherings, closure of public transport, and travel restrictions internally and internationally. Then we have the test, trace, mask wearing, and the protection of the elderly. So, yeah, so these are the variables we are looking at. And then this is our seasonal effect variable, which is the average daylight over the year. So this gives us the median and min-max hours of daylight in the Northern Hemisphere OECD countries. So we can see that there are some differences. And also there are differences depending on where you are located. So in Spain, the differences will be much smaller than like if you look at Finland. And okay, so then I'm just jumping into the estimation results. So this is the type of results we get for the reproduction number. So here we have the containment policies, then test and trace, and all the other guys. It's difficult to see them in the coefficient, so I just show you the magnitudes in this chart, which depicts the effect on log R of the different policies. Different shades, the darker shades relate to the most stringent levels of policies. So you can see that workplace closures have the biggest impact on the logged reproduction number, and then the impact increases as we increase the level of stringency. And then we have the other measures which are producing smaller impact, but still non-negligible. And then we have the test and trace and facial coverings, which are surprisingly low. So the question is, why is that? The potential explanation for test and trace is that the variable we are getting from the Oxford University, they are kind of like crude. They don't really capture the speed, the coverage, and how you isolate people. So then this is just like too crude measure. And for mask wearing, probably why we get this small number. So these are country level. So these are estimates. So these are estimations which we carried out for the panel of OECD countries. So then these are average effects at the country level. So might be that even though you have the most stringent mandate for mask wearing in a country, but if compliance is low, and if people tend to wear masks in an inappropriate way, like on the chin or just not covering the nose or something like that, so then our indicators do not capture these effects. So that's one possible why we get these small effects for test and trace and mask wearing. Okay, so then, okay, we can now look at the vaccination effects. So we get some very large effects, especially for the variable capturing vaccinated twice. And then we can, so then the coefficient estimate tells us how on each percentage point of total population fully vaccinated would lower log R. And we can convert this coefficient into equivalence with other lockdown measures. So this is a simple way to presenting these results. And basically what we can see here is that like vaccinating about 7% of the total population, like vaccinated twice, has the same effect as complete school closure. And also, like if we vaccinate 20% of the population twice, this is equivalent to fully closing all but essential workplaces and public transportation. So these are pretty powerful effects from vaccination. We also get some seasonal effects. So seasonal variations can add 0.15 to 0.25 to the reproduction number. And we also managed to find that the UK variant, which is the alpha variant, if it would have a prevalence of 100%, it would increase the reproduction number by almost 50%. So that's a pretty large increase. For the Delta variant, the Indian variant, we don't really capture yet in our data. So we don't have any significant results. It's still too early for our data set, but it's still coming. Like if we update the results in late summer, and probably we would, or early September, and probably we would get some even bigger impacts than from the UK variant. Okay, now we can come to the GDP impacts. So here we basically have the continent measures. And we have a couple of controls of like fiscal policy control, and we have death rates, which is a measure of natural caution, so how people would react without the policy measures. So this is a chart giving us the maximum effect on GDP of the measures. So we can see that the biggest negative impact is coming from the workplace closure. So you might remember that this is the measure which also is the largest impact on the reproduction number. And then we have smaller effects from restrictions on gatherings and restrictions on internal movement. So the GDP effects from these guys are smaller. Okay, so and then the last part in the paper, we do some scenario analysis using the question estimates from our regression analysis. And what we do basically, we take a typical OECD country for this level of stringency. So we take the median level of stringencies for OECD countries in the first part of 2020 this year, and try to set up a couple of scenarios with the slow and with the faster vaccination rollout, and with different variants like the last year version of the virus, and then the UK, and then the Delta variant. And for the Delta variant, the Indian variant, as we don't have our own estimates, we're gonna use some estimates from the literature. So then we just calibrate how the Delta variant would increase the reproduction number. Okay, so these are the questions we use, which are in red. And then on orange. So you can see that we don't use the maximum level of stringency for most of the variables, because for the median OECD country, it's not the highest levels. Like workplace closure is the second most stringent, but not the most stringent version. So I now baseline. So this is a waterfall chart, which the red bar gives us the factor increasing the reproduction number. So this is the R0, which is coming from our estimations. And then we have the yellow bars, which tell us what are the factors reducing the reproduction number. And we should have an eye on the green bar, which is the difference. And this number should be smaller than 0, because this is the impact on the log reproduction number, and the log reproduction number smaller than 0 is equivalent to reproduction number in levels below 1, and we want to have effects which bring down the reproduction number below 1, and in log terms below 0. So we can see that, so if we have a starting reproduction number of 2, then we need a number of containment policies put in place to bring the number below zero. Then, if we introduce the UK variant, then we have an extra increase in the reproduction number, and then we introduce moderate vaccination rate, which is very moderate, 13% of total population vaccinated twice. Then it's not enough. We need to implement an additional measure, which is school closure, to bring down the reproduction number below 1. So to get to the green bar here. Now, if we have a faster vaccination rollout of 40%, which is vaccination rollout vaccinated twice, then we see that this has a powerful effect, and because we need less containment policies, like we can take out workplace and school closure, stay-at-home requirements. They are not here anymore, and we can have a lower stringency for gatherings. So then, once vaccination is well progressed, then even in the presence of the Alpha variant, we can lift many of the containment measures. And of course, if we have vaccination over 70%, that's game over for the virus. At least if we have the Alpha variant. But the problem is that now we have the data, and we've seen on the first chart for the UK that the Delta variant is even more aggressive than the Alpha. And so we added the conservative estimate of an increase in the reproduction number coming from the Delta variant, which is 50% more contagious than the Alpha. So then we end up with a reproduction number above 4. And then even if we have the vaccine, so it's vaccination 40%, the typo. So if we have a vaccination, 40% of population is vaccinated twice, we still need all the other containment policies put back in place, because just like such a huge additional increase in the reproduction number. In order to bring down the reproduction number below 1. So this is not great, and this is a warning that as the Delta is becoming more prevalent in many countries, or will become at some point in Europe and elsewhere, then it's really crucial to speed speed up the vaccination rollout. But I would like to finish my presentation with the glimmer of hope, showing this chart from the UK, which is depicting the relationship between hospital admissions per 100 cases in 100 new cases and the share of population vaccinated twice. So you can see that if you have like 40% of your population vaccinated, then hospital admissions are falling dramatically. And so this implies that even if you have a number of new cases because of Delta variant, but if you have a decent level of vaccination, then higher levels of the reproduction number can be sustained for a longer period of time without overwhelming the hospitals. So yes, this is basically it. So just like a couple of points. So the new variants are boosting R by quite some margin. We also find that seasonal effects can matter, but this is dwarfed by the incoming Delta variant. So this is still it can come into effect as of September or October. Vaccination, not surprisingly, is very powerful and reduces the spread of the virus. But unfortunately, vaccination rollout is not very well advanced in many OECD countries. And this is worrisome because of the Delta variant, which is coming in very, very quickly. and which is very transmissible compared to the other earlier variants, but vaccinations reduce the burden on hospitals. So that's the good part of the bad storyline. Thank you very much.
Thank you very much. This was a very powerful overview of the UK with implications for the rest of us, I'm sure. Thank you all, three speakers, for being so beautifully on time. We have 20 minutes now until we have to finish at 11:30 for a give and take, for questions and comments to the speakers from participants. Who wants to be first? The floor is open. Let me be first, if I may. I was intrigued by the story on family ties, and it brought to my recollection a story that was published about a year ago, comparing Greece with Sweden. The death rate in Sweden has been much, much higher than in Greece. And the researchers in question, they pointed out that old people in Greece typically stay at home with their families, where there is relatively limited traffic. Whereas old people in Sweden typically stay in old people's homes, where there is a lot of traffic because of the number of caretakers that come and go. And this is why the researchers concluded contagion among old people and death rates were so much higher in Sweden than in Greece. Is this something that is part of the family ties stories that we heard? Francesco.
Okay, thank you for the question and the comment. Actually, family ties as a social capital is a multidimensional phenomena. And so, if I can put just quickly the slide on, just quickly. You can see that, I don't know, can you see the slide again?
Yes.
Okay. If you see the two dimension of the family ties, you see, for example, that the help child dimension is this one, that I put it magnified on Europe. You can see that Sweden and Greece are pretty much the same. And so this can explain the higher rate of contagion, for example, in Sweden. So a child is the channel that goes from parents to child, is when the parents care about the children's well-being. If you go to the other dimensions, love parents, and so when children care for their parents, you see different story here. Sweden is the lighter in Europe against the Mediterranean part that is always darker. So it could be that it depends on the channel of family ties that you are taking into account, that you can explain different phenomena. Clearly, if you take the principal component, you see that Sweden has overall a lower family ties than Greece, and so this can be counterintuitive given your example on the pattern of contagion between the two countries. But if we split the two components of family ties, probably we can reconcile this analysis. I don't know if Professor Mare wants to add something.
Yes, why not? If I am allowed, I would say something. What we observe in Italy, that Torvald, your point is very right, is that family tie is a multi-dimension issue. The key aspect, at least in Italy, due to our experience, of course, is grandparents live with a nephew and so on. That's the key point. The Italian family leave the kids to grandparents, and of course, the kids get the virus and transmit to grandparents, and they go to the hospital and they die. That was the major channel transmission. So that's the reason that, of course, as the last paper just show us, there are two essentially ways to deal with this kind of virus. The first one is vaccination, is the best one. You don't need the same rate of isolation or stringency if you have a very good, let's take the case of Israel, no? The more or less the 70% of people in Israel is vaccinated, and that's very successful in terms of removal of social isolation. If you are not able to vaccinate for many reasons, most of the population, I think that it's true, as the first paper just show us, that there are a huge cost, economic cost, not only social cost, from isolation, from lockdowns and stringency. But at least in the first phase, maybe in the second also, there are no other answer. The only answer is vaccination, or we have to take with different feeding, like in Sweden, like in Iceland, or like in Italy, or I don't know, maybe in the United States, different mix of isolation. I would say socially acceptable isolation. In Italy, we have a very, very strong isolation, a very strong stringency. And in fact, in terms of GDP, I think that Italy is one of the highest, the second country with the highest GDP lost cost, of course, because we shut down for more or less 6 months, everything. So that's very easy. Anyway, what you mentioned, the family ties dimensions, that we say something in Italy is very old adagio, is much more risky to have dinner with your grandparents than to go outside for something else. So summing up, that's our point. Thank you.
Thank you very much. Anyone else with questions or comments? The floor is open.
Isn't there one more dimension along which Sweden differs from Greece, which is trust of the authorities? That the Nordics, Sweden should be one of them, where people trust each other and trust the advice of the government, whereas in Greece, it's less the case. But I'm told by my Greek friends, there was this one doctor in charge of the measures in Greece that everyone trusted. They didn't trust the government, but they trusted this one doctor. But the element of trust must, like in the US, it differs between states along political lines. So that isn't that a big part of the story in your paper, Francesco, the trust?
Yeah, yes, clearly trust is among the channels that we control for. Again, just for the sake of completeness, I will show the chart. You can see that, can you see the chart?
Yeah.
Yes.
Yes, clearly northern countries are the one with the higher trust in Europe and probably in the world, as you can see if I put it smaller. And we are capturing the impact of trust on the rate of contagion, because we see that where trust is higher, the level of contagion, ceteris paribus, is lower. So this is we are not the only one that are saying this. Actually, there are many papers now that are showing that the level of social capital, and in particular the level of trust, is a particular element that should be taken into account when considering the effect of stringency measures. And clearly this is part of the story, and is an element that we are using among the controls. So it's capturing this factor.
Thank you.
If I add something, Chairman, that I agree, that's a key point, maybe more than family ties. The trust is the key, one of the key aspects to understand what's going on in what went on in the virus transmission. Let's say, for example, we have just run a very huge survey for Italian population, And that's very interesting to see that if you ask two people, how much did you follow the government rule, they answer more or less in Italy, 90%, 95%, 98%. Then we ask, do you think the other people follow the rule? 60%. So that's in a point, it's of course, it's a question of trust. You think that you follow the rules, but not the other. And if the degree of trust is low, of course, all the policy of containment and also what you mentioned, Gilfi, about Sweden or about the country of Northern Europe as compared to Greece, Italy, maybe Spain, I don't know. So I think the trust is very important in the not only in the policy for isolation or and lockdown, but also to be sure that people follow the rules and make more effective what the government right or wrong decide.
Do you see, can I ask, do you see a difference between South and North in Italy? Because there must be a difference in trust.
Go, please, Francesco, if you want, or I'm going to, please, Francesco. Okay, yes.
We find this difference, yes. Of course, this is not part of this paper. We are thinking maybe to include also a snapshot on Italy. But what we observe using the survey that Professor Marais mentioned before is that the speed of contagion rate between the first and the second wave is very related to the level of trust, that in Italy is much higher in the north and is lower in the south, with some exceptions, of course. And we see that the correlation is very high. So in the part of the country where the trust is lower, the speed of the diffusion of the disease has been higher between the first and the second wave. This is what we observe.
Very good, thank you. Anyone else?
Professor, there is a hand high.
Yes, please go ahead.
Professor Hieronymi, could you open your audio and make your question?
Can you hear me?
Yes.
Yes.
First of all, I would like to congratulate you, Professor Paganetto, on this conference. I have a short question. How do you include in your scenarios and in your analysis the impact of large gatherings? It seems to me that there is no agreement on the impact of large gatherings like the Euro, like Wimbledon, and coming up, the Tokyo Olympics. And have you included in your models and in your scenarios the impact of these potential impact of these large gatherings?
Thank you. Who wants to address this issue?
I guess this is it's a question for me.
Okay, go ahead.
So I just reshare my screen. So we have gatherings, but of course these are not this type of like very large. The Euro and the tennis games. We would need to parameterize. So there are specific studies looking at NBA and NHL games in the US from last year at the beginning of the pandemic. So we might have some ideas how these large sport events might impact on increasing R, and then how we should forbid them, how they would reduce R. But they are not, these large sport events are not factored into our scenario analysis. So then this should be like probably a bigger effect here. And also I haven't mentioned that when you look at the literature, for all these measures, there is large controversy. So that we have a large range of what the impact might be, like for workplace closure, like stay-at-home requirements, gatherings. Some studies find a large effect, others find smaller effects, and depends on how what they do. Many people do only like specific types of policies, not looking at all the policies. Sometimes they look only for a couple of countries. So yeah, so these should be taken with some caution. So these are just like our estimates from the cross-country time series OECD panel regressions. And if you want to be more cautious, we should have some kind of like ranges for all policies, which we may want to do in the future extensions. Thank you very much. Very, very, very good question. So probably in the next version, we would need to address this effect in the scenario.
Thank you. Any other questions or comments? We still have 5 minutes. Is everything settled? Gilfred Marias, may I pose a question to you? Is it possible to use the golden rate of social distancing to decide between having a 2-meter rule versus a 1-meter rule? Or would that be taking the analysis too far?
Well, yeah, I think that so in our model we have this variable S, which is an indicator of social distance.
Yes.
So I think that we could differentiate between 1 meter and 2 meter by saying that 2 meter implies higher S or something like that. So yes, I think we could, but of course, this is just a simple model, so we don't have any sort of variables are just indicators. So the difference between 2 meters and 1 meter would just say that we have a higher S with 2 meters but lower S with 1 meter. So we can say basically what will happen if we would increase social distancing by going from 1 meter to 2 meter. Yeah.
Fine, thank you very much. Let me see, are there any other questions? I must say that I was deeply impressed by all 3 presentations. They contained a lot of new information for me, and I trust for many of the other attendees as well. So I think then it is time for us to adjourn the session, even if there are 5 minutes left. I cannot promise you a longer coffee break because that is up to you where you are. So I send you my best regards to Reykjavik, to Bari, and to Paris. So thank you all very much. This was brilliant.
Thank you very much. Thanks.
Bye-bye.
Bye.
Bye-bye.
Thank you. Bye to
Bye-bye.
everyone. Professor, I see Mattia Bevilacqua.
Morning to you all. I'm pleased to chair this session with four papers to discuss. We have 1 hour and a half, and giving 20 minutes for every presentation, I think that we are in respecting the timing of the suggested by the organizer, and at the end we have a few minutes for questions and short comments. So I think in the program I want to say hello to Lorenzo Codogno. Ciao Lorenzo, and to Professor Van Den. And please, Lorenzo, I suppose you are presenting. When you want, you can start.
Thank you, Michele, and thank you all, and thank you the organizer for the invitation to this conference. Let me try to share my slides. So here we are. I hope you can see that, right?
Yes, right.
Okay, very good. So again, thank you for the invitation. It's a pleasure for both of us to be back in Mondragone, and although virtually only this time, hopefully next time it will be a physical meeting. The title of our paper is Assessing Next Generation EU, as you can see here, and let me jump into the motivation of the paper. Next Generation EU, the big package introduced by the European Union, is a welcome policy response to cope with the pandemic economic shock. But the question mark is how will EU respond in the future? And for that, we think that the current scheme is probably suboptimal. And so then any future response should be at least as powerful as Next Generation EU, but it should be more sustainable. And by sustainable, I mean also politically sustainable and automatic and timely. And I will get back into this. We have a stylized macroeconomic model that indicates that an alternative approach is possible, and that would imply ex-ante risk sharing through the creation of a safe asset, a slightly different version of the safe asset we have today, and the permanent fiscal capacity at the center, which should be, these two features should be part of the scheme. Let me now move to the next slide, which is the rationale of the alternative approach we are proposing. The Eurozone is vulnerable to a financial or real external shock that when we have seen, unfortunately, the pandemic crisis as one example of an exogenous symmetric shock that affects countries in an asymmetric way. Why is the Eurozone still vulnerable? It is vulnerable because of the legacy of high public debt in the periphery. Secondly, there is still a very strong exposure of banks to periphery debt, which creates the so-called doom loop. And third, there is an excessive reliance of monetary policy, which has limitations and also drawbacks, and we'll get into that. So there is a need to lighten the burden of stabilization. We are discussing here macroeconomic stabilization and lightening the burden, particularly on those countries that have high legacy debt and which constrains their policy response, and the ECB due to the effective lower bound and the constraints on the transmission of monetary policy, and we will get into that. The legacy of public debt in several member states, and also, I would say, some ideological priors against some discretionary fiscal policy that has been overcome in this current occasion, but there's no guarantee that it will be the same, will support the same answer in the future, makes the rebalancing of policy only achievable at national, supranational level. So that's why we propose a fiscal capacity at the center. And there is clearly a need to avoid unnecessary strain for the economy, which was by and large avoided this time, but again, with a scheme that is not fully optimal according to the model we have produced. And so we prefer something different for the future. The aim is to preserve market discipline, avoid moral hazard, which has always been the problem in Europe for so-called rigorous countries, or countries that want to avoid that others take advantage of the situation. So market discipline is one main factor. Avoiding moral hazard is another, but also there is a need to enhance welfare for all. This is the rationale of the paper, the approach. Let me just move very quickly. This paper is a paper of a series. We started with the first paper, was presented in early 2019, and the paper was a first model that was a simplified model, and basically presented the same features that we are presenting today, but it was applied to the previous crisis, 2008-2009 crisis, and to the 2011 sovereign debt crisis. Then we moved to another paper in April 2020, again focused on this model, but the model was enlarged, was in the model was introduced a part which relates to the banking sector and financial sector, which was expanded significantly. Then clearly the crisis struck, and we had to face the new policy response by the EU to the crisis. So we basically moved from the previous crisis to the new crisis and tried to assess the current one. And then we produced a third paper. This is the fourth paper of the series, in which we basically update all the estimates according to the data that are now available about the European package. And there were also some policy briefs written in the past. I've dropped them. Now, first of all, let me say that the policy response in Europe, at least so far, has been appropriate. There is no reason to believe that it should have been more sizable and faster. At least it looks like it's appropriate given the size of the contraction and the output gap that the Eurozone has. And this is compared to the US. You see US, you can argue that it has been a little bit oversized. But again, in Europe, taking into account the national measures that are expected to be introduced for the current year, it seems broadly appropriate. Now, we all know the details of Next Generation EU. There are many countries, call them conversion countries, or countries that traditionally benefit from cohesion policies in Europe, that will benefit from a massive amount of money, sometimes in excess of double-digit as a percentage of their GDP. However, in terms of absolute amounts, we all know that Italy and Spain will be the two countries that will get the biggest amount of resources. And so it will be up to Italy and Spain to really show that it works. Now, this is a graph that is estimated, taking the effects of the package on GDP growth. This is based on estimates by the Commission for the 12 countries that have already been assessed by the Commission. For the remaining countries, we use our own estimates to come up with an estimate for the EU and the Eurozone overall. And you see that it is quite sizable. This is in terms of levels, and there's been a shock, okay, to the model, and you see that the effect on level is quite sizable over time. But we all know this. So let's me move to the strengths and weaknesses of the current Next Generation EU approach. The strength is clearly linked to the sign of solidarity among countries. A taboo has been broken, which is the taboo of European bonds, safe assets for the whole of the EU. The size is pretty big. Okay, you can argue that it could have been even bigger, but it's pretty big. And again, broadly speaking, in line with what was needed. The weaknesses. The take-up might disappoint. We have seen just a few days ago that so far, basically, there are only 3 countries that asked for the loans, while the grants, of course, were taken by all countries. The ex post nature might disappoint, because the way it works is that the countries will spend the money and then will ask the Commission after the fact. Although there is also an advance payment of 13%, which should be disbursed during the summer. And also it is very much ad hoc, so it's not easy to replicate. So there is no guarantee that should another shock hit the economy in the future, European leaders will come up with a similar answer. So, in order to come up with this, we have again designed this different scheme. But before that, let me just briefly mention the literature review here. Monetary policy cannot absorb asymmetric shocks, so it's very much about fiscal policy. But fiscal policy is constrained by the rules, so that's why the EU decided to suspend the current fiscal framework. The alternative adjustment mechanisms are still underdeveloped. Asymmetric shocks in the EU and especially the Eurozone, because we are focusing on the Eurozone because of the same monetary policy, lead to temporary economic divergence, which was really one of the reasons why the leaders immediately realized that they had to do something about it. Now, traditionally, the role of shock absorber was actually left to the EU internal market. So if there is a fully integrated internal market with labor and capital fully integrated, that should actually make it easier to absorb the shocks. Secondly, reforms of product and labor markets to reduce the hysteresis. And finally, creation of fiscal space in good times so that when the shock hits, you have space to allow automatic stabilizers to work freely. This was the traditional view before the 2008-2009 crisis. Then we had the crisis, the doom loop between the sovereign and the banks was a big feature. So higher risk to sovereign default due to the insolvencies of the domestic banking system. And therefore, there was a need to address that issue as well. Then liquidity and solvency problems for banks became also a problem for sovereigns. Now, monetary policy, we know that it's already de facto close to its limits, the so-called effective lower bound of monetary policy. So there is a need for an asset that has collateral for interbank loans and repos and ECB funding that is perceived to be safe. And then you have a need to break the link between the banks and the sovereign. And at the same time, you have to preserve market discipline. So how to do it? Well, you know, the policy response was insufficient the previous time. This time, again, is good, but it's suboptimal according to our model, and we'll get into that. This is a little bit a literature review about safe asset and fiscal capacity, but I will skip that. Let me jump into our proposal. So the design. We propose to have nation sovereigns held by banks. So the debt held by banks swapped for safe assets. So the banks have national bonds and they swap them with safe assets for at least 30–40% of Eurozone GDP. National sovereigns lose eligibility to QE and repos. That is a way to incentivize the use of the new safe asset. Fiscal capacity to fund pan-European investments, which is similar to what we have right now, but the size is definitely bigger. Rationale, it should be automatic and immediate, so no recognition lag as it happened this time, and the part of the funds are triggered effectively by the business cycle. It's ex ante sharing instead of ex post transfers as it is right now. So less uncertainty, and effectively you break the doom loop because again, there's no link between the banks and the sovereign. Stronger fiscal discipline because countries would still have their own national debt and they better behave in a proper way, otherwise the spread on the national debt would widen. So that prevents moral hazard. Several advantages here. Again, I just mentioned the moral hazard here. Central fiscal capacity for automatic stabilizers and discretionary spending. That would be, a boost to the capacity of fiscal policy to react. There will be a genuine risk-free asset like the U.S. Treasury, and that would be a big feature of the project because it would immediately scale up to a size that would be perceived as a truly safe asset. And also, quantitative easing would become a genuine monetary policy instrument because right now there is always a feeling that there is a mix between monetary and fiscal, and effectively monetary policy could be trapped into the fiscal side. A better transmission of monetary policy through the banking channel because effectively, if you have the situation of the doom loop, as I mentioned, effectively that prevents monetary policy to be fully effective in the transmission of monetary policy through the banking channel. So let me say a couple of things about the model, then I'll pass to Paul. The setup of the model. We have two-country monetary union. The two countries are so-called core and periphery. It is a standard Mandel-Fleming model with doom loop. So bank credit acts as a constraint on activity. sovereign yields affect bank credit, and activity feeds back to yields via public debt. Baseline assumptions, we have an adverse demand shock of -10 and -15% of GDP. We have an adverse supply shock, respectively, of 5 and 7.5%. And then we have a risk premium shock on core yield, so basically flight to quality. And that is the baseline assumption of the model. And now I'll pass the floor to Paul for the details and you know, the setup of the three scenarios. Paul, please.
Yes, thank you, Lorenzo. So we have three scenarios. The first scenario is basically the policy that put in place just when the pandemic started early last year. So that includes national fiscal stimulus. That includes also some of the EU programs like SURE. Then we have a second scenario in which we ship in next generation EU, and a third scenario where we put in assumptions that relate to our alternative scheme. So if you can just go to the next slide, please, Lorenzo. Then, so scenario one, we have the risk premium shock to the periphery of -2%, offsetting the negative shock we had in the core as a result of the availability of an ESM credit line, which has never been used. We have a monetary policy rate cut plus QE of almost 25% of GDP, which seems to be in the cards more or less. We have national fiscal stimulus of about 2.5% of GDP. And we have, as I mentioned already, the SURE scheme, which mostly affects the periphery. So in scenario two, we put in grants of 1% of GDP in the core, 4.7% GDP in periphery, loans 0.4, core 6.9 periphery, and then we have several other smaller programs. And then we reduced national fiscal stimulus a little bit because of it's somewhat being squeezed by the supranational fiscal stimulus. Now, in scenario three, we assume the same aggregate fiscal stimulus as in scenario two, but it's now rather than implying a transfer from the core to the periphery, there's no longer a transfer. There's an equal distribution of funds from the center to the member states. We do have some transfers via the automatic stabilizers, which operate at the center. So to the extent countries have different responses of unemployment, they will have a different take from the center. We cut QE by half, and only the safe asset is eligible and not the national sovereigns. But on the other hand, 40% of GDP worth of public debt is now owned by the center. So if you can continue, Lorenzo. So here are some of the results. First, we look at the yields. The red bars are always the periphery, the blue bars are the core, the gray bars are the aggregate or the fiscal capacities, so the supranational level. We see that the yields in scenario one, especially in the periphery, increase tremendously, 600 basis points. Which, if it had happened, it hasn't happened because Next Generation EU was announced and put in place. But if that had happened, obviously we would be in a totally different world than we are in reality. And when we ship in Next Generation EU, this yield spread diminishes tremendously, so almost nothing is left of it, as we have observed in reality. So, however, if we put in Next Generation EU, we see that the yield spreads again widen a little bit, and this is because in our program, national sovereigns are no longer eligible to QE. So that's why we say that in our approach, there would be less moral hazard than there is in the current, in the actual policy. The bank credit would virtually collapse in the periphery as a result of the widening yield spreads and the higher funding costs for banks in the periphery, which hasn't happened to this extent, and this is the result of supranational policy being quite powerful. So we can go to the next slide. This is the impact on the primary deficit and debt in the three scenarios. So the baseline scenario, just national policy plus SURE, we see debt expanding in the periphery by more than 40 percentage points of GDP, and in the core still by about 15 percentage points of GDP. But if we ship in next generation EU, we see that this increase in debt would be substantially smaller, of the order of magnitude of 10 percentage point of GDP. However, there would be more debt. There would be debt created at the supranational level. The same would happen in our scenario 3 with our own program. So there is not a huge difference in terms of debt and deficits between the programs, next generation EU and our own proposal. So if we can go to the next slide, this gives some more detail, but you will find that in the paper as well. It's too many numbers to just discuss, but the charts I just shown were derived from this table, which gives you the detailed results. So we can go to the next slide. So if we compare scenario 2 to scenario 1, and in other words, if we compare next generation EU to no next generation EU, so then the contraction output is considerably smaller with much less divergence between the core and the periphery. So that's a good feature of next generation EU. Now, widening yield spread would be neutralized, while bank credit would not shrink that much. On the fiscal side, we see primary deficits at the national level still increasing substantially. But especially in the periphery, this is a much smaller increase than in scenario 1, helped by the more favorable macroeconomic environment and, of course, automatic stabilizers and the transfers from the center. So we can go to the next slide. If we compare scenario 3 to 2, in other words, if we compare our own proposal with next generation EU, then we see that the aggregate stabilization is more potent than in scenario 2. And this is especially because the core would perform better than in scenario 2. That is not so surprising given the absence of discretionary fiscal transfers from the core to the periphery in our program. The yield spread, I already mentioned, that widened somewhat more in our program, and this is good because it diminishes moral hazard. And the fiscal monetary policy mix has shifted towards the former, so towards fiscal, and this is because we have less QE in our program. We don't need as much QE in our proposal than we actually do with next generation EU. And since the ECB would purchase the common bonds, so the safe asset only, its yield is now sort of disconnected from the national yields and falls relative to them. If you can go to the next slide, and I think I'm almost there. Yeah, the conclusions. Okay. I think I've already gone through them, so I don't think we need to repeat this. If we can go to the last one, Lorenzo. So with a safe asset and a partly rules-based fiscal capacity, more of the pandemic shock would have been absorbed, and we would need less quantitative easing. The asset purchases by the ECB would be directed to the safe asset rather than to national sovereigns, and thereby avoid the political conflict that this could entail. So the current policy response of next generation EU we see as second best, less powerful, less efficient, though still powerful and still vital. But our exercise shows that it would be worthwhile to consider a more permanent macroeconomic stabilization mechanism in the future, with less emphasis on transfers and more emphasis on achieving an appropriate policy mix. So let me stop here. Thank you very much.
Thank you, Professor van den Noord. And now, very interesting paper, Professor and Lorenzo. I think that for me, it would be necessary to have time to understand better. I share the vision, absolutely, but for the details, it's important to have time to reflect. And especially on the side of the relationship between sovereign and banks, to understand what will be the best way to give safe assets to the banks and giving to the national sovereign the possibility to be absorbed by the system. This is a point that of discussion in the debate, and well, I think that we can go on, and next paper is will presented by Sergio Inferrera, IWH CompTNet. The title is Globalization in Europe, Consequences for the Business Environment and the Future Patterns in Light of COVID-19. Please.
Okay. Thank you very much, Professor Bajalla, for giving me the floor. I think you should see the slides right now. And I would like to start by thanking the organization for the opportunity of presenting my working paper in this conference. Let me stress that this is still a work in progress, so I'm extremely grateful for every comment you may have. Let me start by giving you an outline of my presentation that will be divided into two main parts. In the first one, I will introduce and motivate my analysis, while in the second one, I will present my results, discuss them, and if I have still some time left, I will present you a project I'm working on, a very exciting project. So let's start. Let me start by specifying what I mean by globalization, since there has been an unsolved puzzle in the literature regarding its measurement. Here I focus on globalization that is measured by trading global value chains. And with this premise in mind, I try to assess two research questions. The first is related to the impact of GVC trade on firms' performances, market power and concentration. And in the second one, I try to quantify the disruptions that happened along the international supply chains due to the pandemic. I relate myself to three strands of literature very briefly. The one regarding the consequences of trade on firms' performances. This is already a vast literature, but it's focused mainly on traditional trade, and there is less evidence regarding GVC. Then I relate to the literature studying the unintended consequences of trade. There's the seminal paper by Oates that focuses on employment outcome in the US, but there's even more recent work by Colantone and Stanning that focus on political outcomes and on mental health. Here I focus on firm-related outcomes, namely market power and concentration. Finally, I intervene on a growing strand of literature that tries to quantify the impact of the COVID-19 pandemic on globalization. Already yesterday, Robert Koopman provided us with some evidence on the topic, and the debate is whether we are living a phase of deglobalization or globalization. The data that I use for my empirical analysis come from 4 publicly available data sources: the component dataset, WIOD, the UNESCO World Bank Trade Cost Database, and the Cerdera Encoders database. And I obtained this data for several European economies. The most notable fact out of these is related to the component dataset. Component basically has access to firm level information coming from balance sheet, and it works to harmonize them, aggregate them, and release it publicly, such as a national account, National Statistical Institute will do with national accounts. However, the difference is that it does not provide only aggregate measures, aggregate variables, but it provides different moments of the distribution of each variables, and it provides them at different aggregation levels. So, for example, the industry, 2-digit industry level, or the NUTS2 level, the regional level. The variable that I use for my analysis, the variables that I use for my analysis are pretty standard, but let me specify that I define GVC trade as trade of goods that cross borders more than once, and that I decompose aggregate productivity in line with Olympics into 2 terms: a within industry component and a covariance term. Within industry components measure the unweighted average of firm productivity within a sector, whereas the covariance term measures the extent in which more productive firms are larger. And under the premise that this is a desirable outcome, this term can measure allocative efficiency, and it is known as OP gap. So I want clearly GVC trade is endogenous, and to identify the effect of GVC trade on firms' performances, I need a sound identification strategy. I do this by means of an instrumental variable approach and providing an instrument at the country industry level that exploits trade cost and the distance of sectors along the supply chain. I rely on to wild input-output tables, and my identification strategy is based on 3 steps. The first step, that I call step 0, aims at predicting each element of a bilateral export in value-added matrix. That is a byproduct of an inter-country input-output table. To do this, I use an instrument composed by 2 ingredients. The first one is the indirect trade cost measure, and the second one is the distance between the industries along the supply chain. The indirect trade cost measure is better explained by means of an example. Basically, if I'm interested in computing this measure for a country pair, let's say Italy and Germany, I take the average of trade costs of Italy with each other country in my sample except for Germany. And I weight this average by the bilateral export share, with respect to total export. Then the GVC position index gives me a measure of the position of an industry, the average position of an industry along the supply chain, whether it's more upstream or downstream, so farther or closer to final demand. And by computing the difference between the GVC position index of different sectors, I retrieve the distance between sectors. And by means of equation 3, I predict each element of the matrix, of the bilateral export and value-added matrix, and aggregating the element of this matrix, I obtain predicted GVC indicator that I use in a classical 2-stage least square estimation strategy. Here are the results, and in each model, I control for the ratios of capital to labor and of intermediates to labor to account for changes in the mode of production. And I control for average effort size, and I include a full battery of takes effects. Sorry. In the second column, you see that GVC trade has a positive causal effect on aggregate productivity, but that this is due only to the within industry component of the decomposition I introduced you earlier. Indeed, the fourth column shows that the OP gap does not play a role in this. The effect of GVC trade on the OP gap is non-significant. This means that aggregate productivity increases without the reallocation, without giving a role to the reallocation of production factors. In column 5 and 6, however, I find that there are two unintended consequences, I would say, of GVC trade, namely an increase in concentration measured at the sector level, measured by the HHI, and an increase on markups. I exploit the component dataset to inspect different logic of the distribution to see whether there are some particular group driving the average effect, a group of firms driving the average effect. And I see that actually this is the case. Indeed, for both the labor productivity and the markup distribution, the effect is increasing along the distribution. You see that from column 3 to column 1, both labor productivity and markup, the coefficient is increasing, and from the 10th percentile to the 90th percentile. This means that the aggregate effect is driven by the most productive firms and the one holding more market power. Finally, I come up for the lack of official statistics to make an assessment of GVC disruptions due to the pandemic. In order to do so, I exploit the framework provided by Serderi and co-authors that basically develop a methodology to transform messages that cargo ships send when they are in international water for safety reasons into economically meaningful indicators that are useful for event studies. Indeed, I plot GVC trade as a ratio of the 2017-2019 average. So here my indicator means that when the y-axis is at 1, it means that GVC trade returned to the 2017-2019 level. And actually see that the projections of these data show a reabsorption of the impact of the pandemic. These are 30 days moving average, clearly, because using real-time data, I obtained a volatile series. These are just the 4 largest EU economy, but you see that the reabsorption is actually spread all over the countries in my sample that are several European economies. Okay. To conclude, let me recap on my main results. I showed that thanks to an IV approach, I showed that GVC trade causes an increase in productivity. This is not a news actually, but thanks to the within firm component and not to the reallocation of production factors. And that, however, GVC trade causes 2 unintended consequences: an increase in firms' market power and consequently an increase of concentration at the sector level. Finally, I showed that GVC disruptions brought by COVID-19 have been almost reabsorbed by most European countries. If I still have time, I would like to introduce you to a project I'm working on, because I think it's related to one of the main limitations of my paper, these are the data that I use. That although being top standard for cross-country comparison, they're still microaggregate, and plenty of literature prescribes us the use of firm-level information for accurate economic and policy analysis. Component, in cooperation with the IWH and the Bergen Institute, indeed has launched the Microdata Infrastructure Initiative. The goal of this project is to build a pan-European firm-level dataset, leveraging existing datasets at the Statistical Institute that are built for Eurostat. So these data are already at the National Statistical Institute, and we work actually to combine them and to harmonize them across countries, with the aim to make possible cross-country research and facilitating data access and data preparation to external researchers. Our infrastructure works like that. We have the business register that serves as a link between different surveys, between different data sources, including the GVC one or the structural business statistics. And we merge these different data sets, harmonizing the variable included in those. Our team indeed worked to harmonize not only the variables, but even the infrastructure that is based at the National Statistical Institute. So we actually do some coding without without accessing the data, and we build in a set of tools and functions that can be used for statistical analysis. Basically, we aim at creating an open source repository of codes that goes from statistical institutes directly to statistical output, for example, charts or tables. And in this way, we hope to create a European microdata infrastructure that is already a reality thanks to the financing of the Horizon 2020 Microprod program. Is already a reality in 6 countries: Netherlands, France, and the Nordic countries. And we plan actually to enlarge to include others. So if you want to get in touch with us to learn more about our project or to use our data to cooperate on a research project, do not hesitate to contact us by sending me an email or visiting our website. And I would like to thank you all for your attention and for the opportunity again.
Thank you, Sergio, for your presentation. Very interesting. And the next paper to be presented is Tobias, is authored by Tobias Adrian, Christopher Herzog, Jasper Linde, and Paul Zabicht. Please, who is presenting?
I'll be presenting, thanks. Can you hear me? So
okay,
Paweł Zabczyk will be presenting.
Okay, Paweł, then you can go on.
Okay, excellent. Thank you. Thank you, Michael. Can everybody, can you see my screen clearly?
Yes.
Okay, excellent. Thank you. So first of all, thanks to the organizers for having us. This is, as Michael alluded to, this is joint work with Tobias, Chris, and Jesper, who are my bosses at the International Monetary Fund. And I guess the usual institutional disclaimer applies here that, you know, these are our views and not those of the institutions or its executive board. So let me try and tell you what this paper is about and what motivated us to look into this. So as you can see in this slide, the COVID-19 pandemic has caused an unprecedented contraction around the world. And this has led interest rates to decline to historically low levels, which you see in the left panel. And it has increased the prevalence and scale of unconventional policy, which you see in the right panel. And while both conventional and unconventional monetary policies can boost aggregate demand by increased risk-taking, they're also associated with potential side effects in the form of growing medium and long-term vulnerabilities. So really the practical policy implications of the underlying intertemporal risk-return trade-off are our focus of the paper. We want to understand what these extra loose policies imply for medium to long-run risks. So how do we do that? Well, essentially, you know, if you look at financial stability remits of central banks, they're increasingly focusing on the buildup of macro-financial vulnerabilities. So in line with these practices, our analysis relies on a policy model developed in a companion paper in Adrian Duarte, Liang, and Zabczyk that tries to account both for the traditional interplay between inflation and real activity, as well as an intertemporal risk-return trade-off. More broadly, our framework accounts for fluctuations in the degree to which an economy is vulnerable to shocks, but is otherwise built squarely upon and can be reduced to the free equation New Keynesian model. And that's why we call it the NKV model for New Keynesian with vulnerability. Now, what we find is crucial and of import is that in our model, the key linkages between macroeconomic and financial aggregates arise through financial conditions, which effectively measure the cost of funding risky projects in the economy and which are related to the price of risk. So let me tell you a bit more about the model before I jump to policy and the implications. So really, there are two key observations underlying our model. The first is what we refer to as the intertemporal trade-off, which you see depicted here. So what this shows you is how a contemporaneous loosening of financial conditions, its impact, what it does to activity. And you can see that, you know, this is on impact, this is positive on activity, this is the red line, and it lowers the volatility, the conditional volatility of the output gap, which is the blue line. So on impact, a loosening of financial conditions is good, But the stylized factor of the observation is that as you allow time to pass, here as you move, say, 2 to 3 years down the road, actually the impact on activity starts being negative. Here the red line dips below 0, and the impact on volatility starts being positive. So, so these are kind of the adverse intertemporal risk consequences of the risk-return trade-off. So that's our stylized fact number 1. Our stylized fact number 2 is this here, and what these charts show you here in the left panel, we plot the relationship between the conditional mean and the conditional volatility of output gap, of the output gap growth. And you can see that there's a strong negative relationship between these two moments. And this is important, I guess, for policymaking purposes, because, you know, in any linear model, we argue conditional volatility is constant, so you'd get here a flat line. One consequence of this negative trade-off here is, and this is clearly manifested in the right panel, right-hand side panel here, is that the top quantile of the output gap distribution here is very stable, in contrast to the bottom quantile, which is extremely volatile. And, you know, this is why, kind of in related work, Tobias has proposed looking at the bottom quantile as a good indicator of risk. So broadly, we think that both of these facts speak to the relationship between activity and risk and financial series, and they were kind of at the motivated our modeling efforts. And, you know, before I go any further, you know, here we have a collection of data simulated from 4 kind of popular models: the standard, linear, and both nonlinear New Keynesian model, a model with a financial accelerator on the kind of firm side, a model and a financial accelerator on the bank side. And really what I wanted to confirm you, to convince you of, is that none of these extant models along these particular dimensions that we focus on does a terribly good job. So, you know, typically these purple lines, which are the kind of simulated scatter plots, either miss the slope of the trade-off, or if they get close to the trade-off, which is kind of indicated by the solid line, you know, they really miss the statistical significance of that. And as a consequence, they would miss the evolution of the conditional distributions. So these are the motivating facts, and this is essentially the model that I constructed. So it's described in different papers. I'm not going to go into too much detail. As just alluded to, there are many similarities between our setup and the textbook New Keynesian model. And we believe that our setup retains many of the appealing features of it. In particular, you know, we rely on standard kind of textbook parameter values to conduct our welfare calculations. Now, despite the parsimony of the structure, however, we show in that paper that the nonlinear setup is sufficiently rich to capture these key stylized facts of macrofinancial linkages. And, you know, in the detailed analysis in Adrian, Duarte, Liang, and Zapchuk, we kind of focus on the monetary and macroprudential implications, which confirm that the findings in this extended model actually differ quite substantially from their linearized, from the simple NK model. So to try and convince you of that, so let me compare, you know, kind of the stylized facts that I started showing you with what our model produces. So you see that, you know, the model does feature an intertemporal trade-off. The initial loosening in financial condition does boost activity on impact, and it kind of contracts 3 years out. And you know, the converse happens for volatility. And if anything, you know, the model still somewhat downplays the amount of the intertemporal trade-off in the data. But, you know, again, relative to extant models, you know, the blue line, for example, would be flat in the standard New Keynesian model. So that's stylized fact 1. On the second stylized fact, you know, you can see that the model also does a very good job of matching the negative conditional mean volatility relationship, and also as a consequence, the conditional quantile of the output gap distribution would be very stable in our setup. So we think that along these 2 dimensions, it's at least an improvement along what was previously available. And, you know, as a cross-check, it is a toy model, but we looked at out-of-sample forecasting performance, and we find that, you know, the model does a reasonable job of forecasting financial conditions, and also, and that uses only information in financial conditions, of forecasting the dynamics of the output gap. So what we're going to do now is we're going to take this model, and we're going to take this model to the crisis episode and see what it tells us about how policy was conducted, and perhaps what other considerations should have arisen there. So, okay. So what we start by presenting is, just to give you a flavor of how the model works, we analyze a 100 basis points monetary policy shock and assume to have a persistence of 0.75. And the red lines here in all these panels, they show the impact in the New Keynesian model, whereas the blue ones, they show the impulse responses in the NKV model. Now, as I mentioned, but I'm going to stress it nevertheless, both of these models have kind of all of the standard parameters identical. So really, what you're observing here are the consequences of adding kind of the intertemporal trade-off into the model, if you like. Now, we figure essentially 4 key lessons from this figure. Now, the first, as you can see in the bottom right panel, is the New Keynesian model doesn't speak to financial conditions at all. So, in contrast, in the NKV model, the initial monetary policy easing also translates into considerably looser financial conditions. I think my connection may have died. I'm back online. Can you hear me? See me? Okay, let me reshare the screen. Yeah. Okay. So I'm not sure where you lost me, but I hope I was legible for the most part. So what I was describing is I was describing these impulse responses, and I said the first kind of lesson we draw is that in the New Keynesian model there are no financial cycles, whereas in the NKV model we get this kind of pronounced financial cycle. Now the second thing that you hear by comparing these lines is that accounting for risk in our setup means that monetary policy is more potent, essentially, because not only effectively because it loosens financial conditions, and the loosening of financial conditions feeds back to the output gap. Now, third, in the original NKV, financial conditions also closely affect risk exposure and can amplify the impact of certain types of shocks. So this fluctuating pattern of shock exposure is effectively costly and is not something you can really show in these impulse responses, but would come through in histograms, which show that kind of in the NKV we have much broader tails of the output gap distribution. Now, in terms of policy conclusion, we think this next kind of slide tells the picture perhaps even better than the previous one. What it shows is it shows the impact of 3 years of forward guidance in the model. And really, if you look at the red lines at the standard New Keynesian model, there is a sense in which a monetary policy loosening or forward guidance is like a free lunch. It allows you to boost activity and inflation, but 3 years down the road, everything is back to steady state, everything is back to normal, and kind of is business as usual. Now, this differs starkly from our setup, in which this persistent kind of rise in financial conditions that monetary policy sets off the financial cycle and kind of leads to fluctuations in output gap and inflation further down the road. Now, so when you kind of, and preempting where I'm going, so when you think that when you're faced with a large and negative shock of the COVID type, in the NK model, policymakers can in principle efficiently stabilize it without many adverse consequences. But in the NKV, what you're going to see is that you really need to start thinking about the medium to long run a bit more carefully. And these kind of cycles and fluctuations that you see here, they really have a kind of a first order impact on welfare, as I'll demonstrate in a second. Okay, so now we take the model that I've just described with the transmission mechanism that I hope I've managed to shed a bit more light on, and we look at a COVID application. So we ask ourselves, how would that changed view of monetary policy transmission affect what policymakers should be doing? And I guess a natural question is whether these intertemporal trade-offs are quantitatively relevant and what they mean for optimal policy responses. So that's exactly what we'll be looking at now. So to get started, we looked at the FOMC economic projections from the September 15th meeting to construct a baseline scenario. And we used actual outcomes up till Q1 for inflation and employment, and we combined them with the FOMC projections to obtain a smooth quarterly forecast path depicted here in blue. Now, as you can see, as these figures make clear, the contraction in real economic activity was really dramatic, of the kind of close, almost, certainly below 10 percentage points. So what do the models, what does the NK model and the NKV model, what do they tell us about how you react to a crisis of such proportions? So we consider two types of responses, kind of in line with what I already discussed. Standard monetary policy loosening, as well as forward guidance. And here in the top two panels, we're looking at monetary policy trying to smooth, whereas in the bottom two panels, we have the implications of forward guidance for the output gap and inflation. Now, arguably, forward guidance in these setup is more realistic given the amount of policy space, certainly in the US for monetary policy, but we thought it interesting to keep the two for comparison purposes here. So what we did is in these exercises, we optimized the size of interventions to minimize welfare losses, where we used the standard welfare loss function. And we also kind of assumed that the policymaker's horizon changes from 3 to 10 to 25 years. And in the monetary policy case, in the top two panels, we found that the optimal cut equaled approximately 15 percentage points in the NKV, but it was significantly larger, 20 percentage points in the New Keynesian model at the 10-year horizon. Now, interestingly, we think in the NK model, the intervention size appears invariant to the welfare horizon, effectively because you get full stabilization further out. There are no costs further out. But in the NKV model, because you start this financial cycle, actually the more forward-looking the policymaker, the more they're worried about these potential vulnerabilities, and as a consequence, the smaller the optimal size of intervention. So to be specific, the intervention for monetary policy shrinks from about 16 percentage points to 14, and for forward guidance, it's halved from 5 percentage points to around 2.5. Okay, now the bottom two panels show the corresponding figures in the experiment with forward guidance when we compute by how much policy rate should be lowered and kept below. And you can see, and in a sense, by comparing the scales on these slides, which are different, but forward guidance tends to be a blunter tool. So in some sense, our model suggests additional costs of having monetary handcuffs on or being at the effective lower bound. So big picture, we draw two main conclusions. The first is that the monetary policy interventions merited by the crisis were very large. Now, that's not surprising. And we think that even if you're cognizant of these medium to long run risks, it doesn't mean that central banks should have done less than they actually did, even if they are concerned about the risk-taking channel. But crucially, and that's one of our main points in this paper, the trade-off, the intertemporal trade-off is missing in the red lines in the standard model. And we think that this is something that policymakers should think about. And this is seen here in the welfare findings, where we look. You see that in the New Keynesian model, you have no welfare losses in the medium to long run, but really they do show up both under monetary policy and under forward guidance in both these models. So I think this is really the main message of our paper. So I can briefly summarize. We think that we don't negate the need to effectively boost demand in order to mitigate the real impact of COVID-19. We think that's uncontentious. We do believe that a major concern is that responding to these corresponding policy actions may actually increase financial vulnerability, and this exercise was an attempt to quantify by how much. And we think that this highlights an important gap between practical policy making and the kind of very highly styled, some of the very highly stylized models used in policy making. Now, what we flag is that the worst that can happen, say in the workhorse New Keynesian model, if a central bank misjudges and provides excessive stimulus, is an overheating economy and temporary inflation overshoots, neither of which are particularly costly when you compare them to an immediate and severe recession of the magnitude of 15 percentage points, which we saw in the Fed's forecast. Now, however, in the NKV model, in contrast to the NK model, in which these costs are absent, policy interventions start a persistent and slow-moving financial cycle, which does affect the paths of output gap and inflation, and which is very persistent. And these undershoots and overshoots over time have significant welfare implications. So quantitatively, as in the last bullet here, the long-run welfare costs with the output gap and inflation volatility mean that under the baseline parameterizations, the optimum size of monetary policy stimulus is around 25% smaller in the NKV than in the NK model, with optimal forward guidance around half the size. These numbers, and we were the first to admit that, this is kind of a first pass, a back of the envelope exercise, if you like. So we think that this merits looking into further, but the direction of travel and kind of the implications are we think fairly clear. So in summary, the cost-benefit analysis, certainly without careful monitoring or additional offsetting measures in place, works out somewhat less clearly in favor of very large monetary interventions in the NKB model, especially when the policy stimulus is very front-loaded. This, we believe, is not an argument per se to withdraw the much-needed stimulus, nor is it a critique of actual stimulus packages, but rather a warning call that the post-COVID trade-offs may be considerably more complex than standard policy models would lead one to expect. This is where I wanted to finish. Thank you very much for your attention. Thank you.
And for your warnings to monetary policy. And the next paper is presented by Mattia Bevilacqua, I suppose. Okay. Okay, the title is The Effect of COVID-19 Relational Systemic Risk. Please, Mattia, you have the floor.
Thank you, Michele. Can you all see my screen?
Yeah.
Thank you for this. First of all, let me thank you, the organizer, University of Roma Tor Vergata, and Professor Paganetto for this opportunity. This is a joint work with Mariam Durgun, University of Nottingham, and Davide Viotto, who is at the Bank of England. So it's quite different from what we have seen so far. This is an empirical paper, and we try to understand which is the impact of all the vast number of COVID-19 related policy on international systemic risk. The message that has come through from almost every presentation today, especially this morning, is that we would need to live with COVID-19 for a while, and COVID-19 changed the global financial and economic outlooks. Of course, COVID-19 has been mostly an economic shock, which has impacted the economy mainly, but it's also been transmitted on the financial market. So we have seen the SP 500, for instance, losing about 5 trillion in value in the crucial period from February to March. And then almost every sector in the stock market recovered, but what is the impact on the financial sector? This has been a bit underlooked, and what we believe is that the COVID-19 crisis had a different impact on the financial system due to the role that the financial system had to play in this crisis to sustain the economic crisis and economic losses. So we think that banking and financial sector were affected mostly indirectly in the first phase, and probably these consequences are still ongoing. So what we try to do in this paper, we try to study how this phase-based range of policy intervention everywhere, globally, implemented by different authorities, central banks, regulators, governments, and so on, unprecedented policy interventions have been impacting especially the financial sectors. What we have seen that stocks in different sectors, or mainly, for instance, technological sector or consumer staples have been impacted less. Other sectors have been impacted more due to the nature of the pandemic. But what about the financial sector, the banks, and what happened to systemic risk? we believe this COVID-19 provided a unique ground to test some of the traditional channels or drivers of systemic risk that we know that we've seen during the global financial crisis in 2008. And we ask, first of all, where these policy interventions, of course, that as main aim and not the one to decrease systemic risk, but where effective also in decreasing systemic risk. And second, did the traditional financial economic channels change during the COVID-19 or prevail in affecting the systemic risk worldwide? So let me give you a brief overview of what we found. We found an homogeneous increase in systemic risk amid the COVID-19 outbreak. And I'll give you some graphical and statistical evidence. But we found a mixed result regarding the efficiency of policy interventions in reducing systemic risk. This has been varying according to the country of study and the policy group policy interventions. So then we conduct a panel analysis and we show mainly that specific variables, bank-specific variables or financial variables didn't represent a systemic threat in this specific crisis, like was the case in the global financial crisis. So in other words, the financial system started from a healthier position than the one in 2006 or 2007. But the spread or the increase of systemic risk was mainly due to uncertainty of economic channels, like we'll see interest rate, really low interest rate and inflation. And overall, we find that there is a disconnect, and this is also found by other papers between the real economy and the stock market, but we found that the financial sector is in between these two agents. So we can go fast on the motivation and contribution. Of course, we relate to the literature on systemic risk. There are also two recent papers, one by Sharia et al. And the other by Lee et al. That studied the relationship between the banking system and the COVID-19 pandemic, but mainly on the spread of the virus itself, not looking at the policy interventions. And of course, our results also suggest that we need to link, we need to put down this framework on the bank's role during time of recessions and the bank role in time to provide liquidity in this kind of crisis. And then lastly, there are studies that, as I mentioned, affirm that there is a disconnect between the stock market and the economic channels during the pandemic. On the measure of systemic risk, we adopt the well-known delta COVAR by Adrian and Meyer as a measure of systemic risk, because we believe that among the stock market-based measure of systemic risk is the one of the best in terms of time series properties, and then it can be easily to compute for a vast number of countries, also emerging countries, and has been found to be an early warning tool in the previous crisis. Here is just the definition of delta COVAR. Maybe some of you some of you might be familiar with. Is just as we define is the traditional way, so is the financial system delta COVAR conditional on the entire market being under distress. So then we can compute this for every firm in our sample and aggregate this among the firms we take in the financial sector of every country. Briefly on the data, we, as I mentioned, this is an international study, so we select a few countries like Brazil, France, Germany, India, Italy, Russia, Spain, Turkey, and the UK and US, but also we this because they've been the most affected by the pandemic, but we also include China, Japan, and South Korea to have a global comparison. Then we have some financial variable, volatility and macro. These variables have been selected from other studies on systemic risk as main traditional channels and drivers of systemic risk. And then we, of course, we include some COVID-19 related variables like the number of cases, but also the stringency index from the Oxford University to control for lockdown measures. Then on the policy interventions, these are collected from the Yale University Financial Stability Trackers. Is a really exhaustive database on policy interventions that have been implemented in every country, and we can also disentangle these policies in two main groups. We will have monetary policy category, fiscal policy category, and macroprudential category. So monetary policy includes in our case both conventional and unconventional monetary policy. So from interest rate changes and about also forward guidance, quantitative easing, asset purchases, and so on. Just to give you some example, on 3rd of March, the US FOMC meeting lowered the target range of federal funds by a percentage point. This is a conventional tool, but there were also other tools like the unconventional. On the 17th of March, the Fed established a commercial paper funding facility. This is specific for the pandemic. In Italy, for instance, on the 29th of March, joint program by the MEF, the Minister of Economic and Finance, then the Minister of Economic Development, and Bank of Italy Banking Association Italiana. They created a task force to support small SMEs, basically to sustain their loans, and also extending microcredit and loans for SMEs. So this is just an example for Italy. Fiscal, in general, is fiscal stimulus to firms, households, and we can have, as an example, famous example from the US, the CARES Act, that spanned 3 main days from March 25th to March 27, 2020. And in Italy, we can include the Cura Italia. Cura Italia was a decree that basically is difficult to categorize because it has been providing fiscal stimulus, but can be also included in a macroprudential regulatory category because it's changed some of the banking regulation. So for every day in which Cura Italia has been passed or discussed, we categorize that day based on the stimulus or on the regulation adopted. And finally, macroprudential regulations with actions aim to relax some regulatory restriction for banks, mainly to free up capital or create credit and liquidity. And an example can be the MMLF in the US, but also the joint work of European Banking Authority and the Bank of Italy to delay some compliance regulatory reports. So what we do now is, first of all, we show the dynamics of systemic risk in our country, and then we study the impact of policy intervention on this time series. So this is the plot for the US, for instance, where 1 is the failure of Lehman Brothers, and then 2 and 3 are main stages of European debt crisis. So nothing new here. Systemic risk in the US was really high in those years. Then flattened down and spiked again after 9. 9 is when March 11, 2020, the World Health Organization declared COVID as a pandemic. And systemic risk in the US spiked. For Italy, different pictures, of course, high systemic risk during a global financial crisis and European debt crisis, but also a bit before. 5 is Brexit vote, referendum vote, so Italy was slightly affected. And then between 7 and 8, there was some political turmoil in Italy that affected the banking system, and then systemic risk in Italy spiked after the COVID was declared as a pandemic. This is also, we test for this, also we test that after March 11, systemic risk in those countries was higher than the 30 days, previous 30 days, and we found that this is significant for every country. So March 11 was a crucial date for systemic risk international. And then we go into our empirical analysis, and first of all, we studied the dummy the dummy impact. So there were dummies are for our policies. So we have a dummy for regulatory policy intervention, dummy for monetary, dummy for fiscal, but also we control for all policies together. We control for number of cases and the lockdown measures. So this is a simple OLS regression. We try to understand whether these dummies for policies helped in reducing systemic risk for every country. But what we found here is really a mixed some mixed results, in the sense that monetary, for instance, policies were effective in Germany, slightly Italy, and that's it, why they had no impact in other countries, no significance. Fiscal was actually decreasing systemic risk when you take the single country, France, Germany, Italy, about US, but increasing systemic risk in South Korea, for instance, and in the whole euro area. So also here, mixed results for fiscal. The regulatory was one of the most efficient, according to this analysis, was useful to reduce systemic risk in several countries. Again, policy also, the old policies together, mixed results. So what we believe is that we need to add a bit of analysis to understand better what was going on. And first of all, we take a step back and we study what were the main traditional drivers of systemic risk. Forget about COVID-19 variables. We just studied the main financial or economic variables in a sub-sample analysis. So we have the whole sample from 2001 to 2020, but also we subsample this to study the COVID-19 and the global financial crisis as well. We see here that, for instance, global financial crisis 2007, from 2007 to 2009, financial variables were really driving systemic risk. There was some unhealthy financial conditions there, and these were the main drivers, as well as volatility and some economic variables. But interesting, during COVID, the financial variables disappear. So clearly they were not the drivers of systemic risk during COVID, but volatility or risk sentiment was one of them. And as I mentioned before, inflation and the low interest rate as well. So this is just to compare as different time periods, in different time periods, different variables affected systemic risk. And finally, we interact these two analyses. So we have our traditional channels, but we want to see whether, according to different policy implications, the channels had varied or differ. So we run the following panel analysis, in which we aggregate the policy interventions at monthly frequency to match the economic variables. And we also control for number of cases, stringency indexes, but also we have some fixed effects. Just to give you the main two results, probably, is that During times of fiscal policies, we see that the main drivers were, for instance, inflation and T-bill, but also NPL. So this can be due by the fact that fiscal policies injected stimulus in the economy. So inflation grew, and this could be a possible problem in the near future. So inflation contributed in increasing systemic risk. When we interact monetary and volatility, for instance, we found this significant. This can be due by the fact that market agents found the monetary policy was ineffective and reacted in a negative way. This also contributed to increased systemic risk. And regulatory also had an impact on leverage and NPL, but also on total asset, because there were some regulatory policies that free up capital. This means that banks had less capital requirements at their disposal, but they could use this capital as they wish. So the bank size mattered more, and we found a positive coefficient for total assets. Of course, we ran a bunch of robustness checks, and our results stayed robust. I don't have time to go through all of them. Policy implications of this study are that we can, our findings can be guideposts for the assessment of market-based systemic risk going forward, and also to take care of this main channel that we found in this kind of crisis. So we know that the banking system will be at the center of the attention going forward for the recovery, and but we need to assess carefully the health condition of the banking system. For instance, we should run some stress tests in the coming years, including also macroeconomic variables like inflation or the interest rate, but also some risk sentiment variables, because we are now in a situation like after the global financial crisis. This is more an economic or liquidity crisis. To conclude, we studied the effectiveness of policy intervention on systemic risk. We found mixed results. So in order to disentangle this effect, we had to interact economic and financial traditional channel with the policy interventions. And we found that economic channels were the main drivers of systemic risk. And we uncovered a disconnect between policies and systemic risk that reflect the disconnect between the real economy and the financial markets, in which the banking system and the financial sector lies in between, because we believe the financial sector will have a high burden in the coming years, and will be a crucial actor for the containment of the economic losses and the future recovery. Thank you.
Thank you very much, Mattia, for your presentation. We have minutes to give floor comments. Floor.
No.
Okay.
Hello?
Sorry?
I would have a question if you want.
Yes. Okay.
Okay.
Please.
It's a question for Pavel, actually, and a very interesting presentation. Thank you very much. If I understood correctly, I mean, you are basically suggesting that the traditional NK models underestimate the effect of financial conditions on the output gap, and therefore the kind of enhanced NKV model produced financial waves, so to speak, so that you end up with policy overshooting to some extent, which would be an argument, in my view, to move more preemptively, which seems to be exactly the opposite of what central banks are doing right now. And so the first question is whether this is correct, my interpretation is correct. Secondly, what would change if you take the forward guidance off? What would change in your model? Thanks.
Yeah, so I think, thank you for the question, and I think this is a fair point and a good characterization. So I think this is exactly what happens. So in terms of so I think absent, so what we do, so this is what I wanted to say, sorry. In the paper, we also look at kind of systematic changes in monetary policy and how you could, and kind of this is very much in line with the thrust of your question of what policymakers could do differently. And you know, one of the things we find, and that's also mentioned in the working paper with Nelly and Fernando, is that actually explicitly accounting for financial conditions and moving in a preemptive fashion, much as you like, is a very potent tool to provide stabilization. And in that paper, we also look at the potential further interactions with macroprudential policy. And we find that, you know, to the extent that you can have macroprudential tools, you can actually eliminate a lot of the instability which is inherent in the system, and particularly in the extended model. And I think that in part is so. In terms of your second question of, you know, kind of what would happen if forward guidance was unavailable, interpreted literally, and you know, with monetary policy at the zero lower bound, we would, and again, abstracting from fiscal policy, which is a big white elephant in the room, I think we would probably, or at least according to the model, we would see a big output contraction. But you know, fiscal policy, it's not that fiscal policy hasn't done anything. So you know, there are many reasons why we would aim off the model. But I think in terms of forward guidance, you know, for us, the most interesting angle there was how blunt a tool it can be, or that it can be a much blunter tool with kind of targeted monetary policy. And that's not something that we saw flagged in other papers. So that was one of the things that I tried to highlight. I hope that answers the question. Thanks.
Thanks.
Other questions? I was thinking that your conclusion on the disconnection between real economic system is very interesting. It's something that is really put many problems for futures. Especially, I am thinking to economy. There is?
Sorry, Michael, I don't know if it was my connection or yours. I missed the last part of your question.
Oh. The question is if you have a disconnection between a banking system and a real sector, and at the same time we have a different disconnection between financial market and the real sector.
Okay, thank you. So what we found is that whether financial markets in general, or mainly all sectors, recovered quite quickly after a few months, the banking sectors will follow more the distress that characterize the economics, because we need to help the economy to recover. So we believe that this is due to the role that the banks will need to that will have in the next years. So it's not like a normal stocks that will be driven by different conditions, different drivers, and actually be held by the economy to be to the stimulus in the economy, but we'll need to create the stimulus. So we'll have a different burden than the other sectors. So we believe that it's in between the whole financial markets and the real economy because of these mixed characteristics.
Thank you very much. Well, thank you for the presentation. Your paper, and to see you again in Villa Mondragone. Bye.
Thank you. Bye-bye.
Thanks,
Bye, everyone.
Thank you. Bye-bye.
Thanks. Bye.